Hello, my name is Faisal Sharif. I'm an interventional cardiologist at Galway University Hospital. This video is about prevalence of hypertension, which is also known as high blood pressure. High blood pressure, as measured by your doctor or the nurse, is known as office blood pressure. And based on this estimate, the global prevalence of high blood pressure is 1.1 billion people. This translates to 30 to 45% of the adult population who will have high blood pressure, nearly equates to 1 in 3 adults who have high blood pressure. As we grow older, especially over the age of 65, the prevalence increases from 45% to over 60%. This is largely due to the fact that older people will have a sedentary lifestyle and they gain weight. If the trend continues, it is estimated that in the next 4 years, the global prevalence will be nearly 1.5 billion people, which is astonishing. Interestingly, this is not related to economic status of the countries. We have 150 million people in Europe alone with high blood pressure, 75 million people in USA with high blood pressure, over 180 million people in China, and over 118 million people in India. This alone shows that this is independent of the economic status of the countries. Unfortunately, we're not winning in controlling blood pressure levels adequately. If we look at any country, and this is true for any country that we analyze, there is about 30% of the population that is diagnosed with high blood pressure, treated with medications, and is responding to the treatment. There is about 30 to 35% of the population that is undiagnosed. They don't even know if they have high blood pressure. And there is at least 30 to 35% of the population that is known to have high blood pressure, has been treated with medications, but is not responding. And we call them difficult to treat high blood pressure patients. Uncontrolled blood pressure is the leading cause of premature cardiovascular events globally. There is a direct and continuous relationship between high blood pressure and cardiovascular events. These events include stroke, both ischemic stroke, hemorrhagic stroke, heart attack, heart failure, atrial fibrillation, sudden cardiac death, and peripheral vascular disease. There is now emerging evidence that high blood pressure is linked to cognitive impairment and dementia. This is correct for all ethnic groups. The good news is that if you follow the advice of your doctors, nurses, and healthcare providers, and if we manage to bring our blood pressure down to 5 millimeter mercury from where it is now, there is a 10% reduction in cardiovascular events that I have just mentioned. And if we double the reduction to 10 millimeters of mercury, there is double the benefit. There is a 20% reduction in cardiovascular events, and there is a 13% reduction in all-cause mortality by just reducing your blood pressure to 10 millimeters of mercury. So every millimeter reduction in blood pressure counts.